Good morning. I'm Dr. Doug Hudoba, the Clinical Director of Premier Dental of Ohio. I just wanted to check in with all our patients here to let you know some things that will be happening as we come back online for regular dental visits in our practices and address any concerns or questions you might have. Obviously, if there's anything we don't get to touch on here, please call one of our practices. Our front desk staff will be in full time next week, and the dentists are returning to our practices the following Monday. So we're very excited to come back online. We wanted to let you know of some things that we're doing above and beyond recommendations to keep all of our patients and our staff and our communities at large safe as we transition back to work. There will be some changes that you see in the practices with regard to when and how we wear our protective equipment. Staff members may be wearing masks beyond just in the clinical rooms, and don't let that alarm you. It's just there are steps that we're taking out of an abundance of caution to create safe environments for our team members and our patients as we get back into this. You will be asked to confirm your appointments prior to coming. We really need patients to respect the challenges that we're under with regard to new stipulations, how many patients we can see at one time, how often we can see them, etc. So if you're not ready to come back for your dental appointment or you're unable to make your appointment, we are really asking that you give us a call and just let us know in advance so that we can better accommodate everybody. We will be implementing what we're calling a virtual waiting room for the time being. That means when you arrive to your dental appointment, we ask you just to kind of hang in your car. You can give the office a call or text and let us know that you're there. And then we will call you back or text you as soon as the room is clean and ready for you. We're doing this to limit the amount of people that are sitting or waiting in the waiting rooms and to reduce the number of interactions that every patient has as they come in and out of the practice. We're also asking patients to come alone to their dental appointment if they're able. We are not allowing any family members back into clinical areas with the exception of medical related guardians, translators, service animals, or parents of small children. We can't have extra patients in the clinical areas. And if you are getting a ride or being accompanied by someone to your dental appointment, we will ask that chaperone to wait in their car while you're back for your visit. You'll also be asked a series of screening questions, both in your confirmation phone call and again when you get to the office. The biggest thing that we need to do to keep everybody safe is to limit dental visits to healthy patients. Any patient suspected of having an illness will not be able to be seen, so we're going to ask you questions related to any symptoms that you've had. Obviously, we all know these by now, but are marked by things like fever, dry cough, aching, chills, and even loss of taste or smell. So you'll be asked to answer some questions on the phone. You'll also be given a questionnaire as you arrive at the practice that you'll be required to sign that says that you've not experienced any of these symptoms. We'll also be taking patient temperatures when you arrive at the office in an effort to kind of protect everybody. So don't be alarmed when we do that. Additionally, patients will be asked to rinse with an antibacterial mouthwash or a hydrogen peroxide mouthwash upon arrival at their visit. Some research is showing this can reduce viral or bacterial loads in the mouth and create a little bit safer environment for our staff, and so we'll ask you to do that. We will also have hand sanitizer right at the entry points of each practice, and we want the first thing you do when you arrive, other than to say hi and wave to our front desk who have probably a little lonely, is to just grab a quick pump and get your hands clean. And that way we set the foundation for a nice clean environment the rest of your visit. We are asking everyone to be super patient with us. We are changing how and when we see patients. So the recommendations from the ADA and the Ohio Dental Board are to reduce the number of patients in the practice at each time and reduce the number of patients that we see per hour and per day. So you might have limited ability in terms of when you can get in or when you can make up an appointment or cleaning that you missed during this shutdown. So please just be super patient with us if you can. We're doing our best to work everybody back in and get everybody taken care of in the way in the best way that they need. Obviously, we ask you, to the best of your ability while you're in our practices, to adhere to some of those social distancing guidelines when you can. When you're in the dental chair, obviously you won't be social distancing from a dentist or assistant, but with regard to other patients in hallways, common areas, waiting rooms, and such, we want everyone to feel safe at their visits. So we are really excited to get back and be able to provide care again to our patients beyond just those emergency calls and visits that we've had over the past 5 or 6 weeks here. Please give us a call if you have any questions or any concerns. Do not hesitate. Call your Premier Dental office. We've been doing an abundance of training and information for all of our team members so that they can answer questions that you have. But we believe that we can create a super safe environment and still provide the level of care that we did before. And we're excited to get you back. We hope everyone is well, and look forward to seeing you at Premier Dental soon. Thanks.